Hi, hello everybody, my name is Asher and welcome to my channel. I finally get to bring to you the episode that maybe some of you have been waiting for about testosterone injectables, and this is the last episode of the series Testosterone All in One Place, so thank you so much for joining me today. I do want to set out some disclosures just ahead of time. Disclosure number one, I am not a doctor. I am simply giving information that I have put together and discovered from all of my research from before I started medically transitioning to today, and to give you my experiences. Before I made a decision on what kind of testosterone that I wanted to do, I did a lot of research and I watched a lot of different videos, and maybe you're considering what kind of testosterone that you want to go on. Maybe you're wondering what's available to you. I know that for me, I'm in Australia, and the majority of the videos that I've seen are from people in America, maybe even a few in Europe that discuss their experiences and what's available in their countries. But there isn't a lot of information about what's available in Australia. And even some of the information that I found, and that when I spoke to people, what they said was available in the United States and what wasn't available in the United States ended up not actually being 100% true. So I figured I would bring to you an injectables episode so that you would have a little bit more knowledge and information to take with you to a doctor's office and ask about, because there are some forms of testosterone that statistically and in the studies have shown to actually work really, really well and sometimes make transition that much easier for people, in terms of troughs and peaks and their experiences with mood stabilizing. And so therefore I wanted to bring it to the fore as to what is actually available, what works, what the pros and cons are. Disclosure number two, just so you know, a lot of the information that's out there regarding the prescribing recommendations for testosterone around the world comes from studies on hypogonadal men as well as trans men. However, a lot of the information is mostly on hypogonadal men more than trans men. So there are some differences. What a trans person will experience versus somebody with hypogonadism, it's going to be a little bit different, and that's why studies have been done. That's why we have the information that we have. That's why we have graphs that show what a trans person might be able to experience and in a rough estimate amount of time. So I will provide tables and graphs throughout this video to show what I have found from the studies. Again, they're from a combination of men with hypogonadism as well as trans men. So please just keep that in mind when you're doing your own research and when you're reviewing these graphs that I'm going to present. Okay, so without further ado, let's get started. Testosterone injectables are the most common form of gender-affirming hormone therapy in the world. Some of the most common forms are testosterone enanthate or enantate, depending on what part of the world you're in. Those words are used synonymously. There's also testosterone cypionate, which is also sometimes known as the testosterone depot or depot testosterone. Both the testosterone cypionate and the enanthate can be injected subcutaneously or intramuscularly. Your doctor will tell you how much of the type of testosterone you're being prescribed to take and how often, based on your blood work, which you'll most likely or should be doing before you're given the testosterone, your continued blood work levels, and your rate of physiological changes. Since there's already so many videos out there about testosterone enanthate, I don't feel it necessary to go into that in depth, except for what is and is not available to you in Australia. As stated previously, your doctor is going to determine your dosage on several factors. They're also going to consider risk factors that come from gender-affirming hormone therapy, which can be blood clots, it can be heart disease, and other things. In Australia, both testosterone cypionate and testosterone inthanate are not common, and they are not covered under the pharmaceutical benefit scheme. It's unclear as to exactly why that's the case, but speculating it might be because it costs a significant amount more money to have somebody on a dosage that needs to be taken weekly or tri-weekly than it is for one shot every 3 months. However, I'll make it clear that is not a fact, it's just a speculation. Australia's version of testosterone inthanate, which is available but not covered under PBS and is not often prescribed, is called Primotestin, and they're pre-filled syringes of 250 milligrams of testosterone inthanate, and you take it every 3 to 4 weeks depending on your doctor's prescribing recommendations and your blood work. So that was just a brief overview of cypionate and inthanate. Both are readily available in the United States. That all brings us now to what is primarily used in Australia and what I've also seen used in Europe. Testosterone indicanoate, depends on what part of the world you're in, depends on who's pronouncing it, is otherwise known as Bayer's Reandron 1000 here in Australia, or Nebido in Europe. It is found to be one of the most steady forms of testosterone injectables available. Having experienced a couple of injections at this point, I can say that in the first week, I'm tired, and in the last week or two before my next injection, I get a little bit tired again, a little bit moody, but my mental health is still spot on. I've improved in my anxiety levels, I've improved in my depression levels, I have more confidence, I feel more myself. And so that depression and anxiety is a combination of, one, I think the hormones, and two, because I feel better about myself and about how I'm seen and the way that I'm presenting, and just the way that I feel in general now when I look in the mirror. So all of that together combined is the effects for me of testosterone in my life and in my medical transition. Reandron specifically has helped me to experience a lot of changes very quickly. And when you're on the, Facebook support groups and things like that, I would ask people, did you experience these things in only like after the first injection, within the first 6 weeks? And a lot of people on inthanates and cypionates said, no, it took me 3 months to feel that, or it took me 6 months to feel that, or it took me 9 months to grow facial hair, if they were on gel or something like that. But I mean, it was first 6 weeks. Now I'm into my first 12-week zone, and the light is kind of washing everything out because I'm really, really blonde. But I've got facial hair growing all through here, mustachy stuff, and my voice dropped really drastically, really quick. My muscles started growing really, really rapidly. My facial structure changed, my hair changed. So many things happened within just the first 6 weeks. And when you watch some of the other videos, you get 1 month updates or 2 month updates, and you're seeing results from them. It appears to be a little bit slower than on the Reandron or the Nebido. Whether or not that's just my genetics or if that's common is obviously not in a study anywhere and is really unclear. When I ask other people who have been on Nebido or Reandron, they say, yeah, I experienced those changes really quick too. So if you look at it that way, it's possible that Reandron 1000, because of the 1000 milligrams being injected and it allowing to slow release into your body the way that your body actually naturally absorbs it, I don't know if that is why things happen so much faster, or I don't know what other reason there would be, but it's not scientifically based. So that's just personal experience, not science. However, we are going to get into the science. One of the reasons that I ended up making this choice over the gels was because of the rate of change and the steadiness of the T levels over the long term. What I did see in the results of the study, the long-term studies, are that your T levels stay higher in that cis-male range more consistently and over a longer period of time. One of the cons is that it has to be injected in a doctor's office. So you have to make an appointment with the nurse, which is covered under the PBS. So you're not having to pay out of pocket for your nurse visits to have your injection done. But you can't pick up your injection until the day that it's supposed to be given. So you can only get up to, it's one refill on May-Jun 1000. So you can go and you get your initial dose. Then you only have one refill that has to be kept on file at the chemist. And you can ask them to order it ahead of time. They know that it's on so many week cycle, or you tell them. They have it ordered in. You go and you pick it up the day that your nurse's appointment is. And then you go in, get it injected, call it a day. But it has to be injected by them in your glute muscle or your butt. And that might be a little bit scary to people because it's a 4 milliliter vial all at once. But I was really scared it was going to be painful, and it wasn't painful. It wasn't painful to have the shot. It was painful afterward. Basically, it was just a little uncomfortable, a bit of a burning sensation immediately afterwards, and just soreness. But within a few hours, it goes away. And if you put some ice on it, it really goes away very quickly. I was completely fine the very next day. So I had no lasting pain whatsoever from this injection. So it seems a bit scary, but it's really not that bad. It is highly recommended, if not outright not allowed, to inject it at home. It's just too much liquid and too large a muscle. It's just, you have to get it done at the doctor's. For some people, that's just too much. They don't want to go to the doctor. They'd rather just put gel on every day. So as I said, we were going to get to the science. So I'm just going to scoot over here for a minute. The table here represents the mean serum testosterone levels of 20 men before and during the administration of May-Jun 1000, represented by the TU mark, and testosterone enanthate, represented by the TE marks. As you can see, the range of TU is much higher and closer to that of a cis male than the TE. However, the more steady initial rate of growth is found in TE, or testosterone enanthate therapies. The TU admin, I don't know how well the resolution is going to look here. So the TU levels are represented by the little triangles and the lines in between. The TE levels are the little squares towards the bottom. The testosterone nanomoles, what we're trying to get to, according to my doctor, is as close to 20 as possible. So on the left-hand side of the graph, you'll see 0 to 60 nanomoles. I might not even be pronouncing that right, but hey, whatever. And then the 30-week period. The next table that I'm going to show you is the example of the first 30 weeks of the TU injections versus the TE injections. Although it appears that TE is steadier in the first 30 weeks, the levels of testosterone still remain significantly lower than the TU injections. After the first 30 weeks, the levels over a period of 110 weeks mellow to normal cis-male levels at that 20 nanomole range, with very mild peaks and troughs. This particular study was mostly conducted on hypogonadal men, but the results of both of these tables and other research helped doctors and endocrinologists determine how to more effectively prescribe testosterone endocannabinoid and at what intervals, on average of 12 weeks, thus providing the datasheet where these tables came from. The link is in the description. In addition, another study was conducted on adolescent hypogonadal men. This table represents the typical experience over a period of weeks on TE versus TU. You'll see the very high peak in TE after the first week, followed by a very quick trough out. while TU reaches a peak around the same amount of time, but not as extreme, and tapers off over a period of many more weeks and does not trough out as low as TE does, regardless. And another table, I told you there was going to be science, another table that showed similar results included 40 hypogonadal males rather than only the 20 that I showed before. Since the same study was produced more than once with the same or similar results, we can conclude that this research has a decently high efficacy rate. Now, before I move on from testosterone and endocannabinoid, I wanted to mention one particular thing. I'm part of a Facebook group that supports each other as trans men. On one of the posts, I commented about Reandron 1000, and I was told it wasn't available in the United States. It blew my mind that the United States would not have available such an amazing option for HRT. And it turns out that, in a way, this person was right. Reandron 1000, under that brand name, is not available in the United States. However, testosterone endocannabinoid is. So it might have been assumed that because Reandron isn't available, that for some reason testosterone endocannabinoid isn't available. But it is. It's available under the brand name Avid. Originally, and I mentioned this before in another video, originally, you had to be a part of an experimental research study in order to be able to access Avid. However, that's no longer the case. The experimental study ended up getting approved, or the use of testosterone endocannabinoid as a result of that experimental program has now been approved by the FDA as a form of treatment. You can access it in the United States. If you go onto avid.com, you can find out about the availability of that particular testosterone and what doctors offer it in your local area. So if you liked what I have presented for testosterone endocannabinoid, if it interests you, if you'd like something a bit more steady over the long term, you don't have to inject yourself every week or every 3 weeks. If all of that looks promising to you, I highly recommend you go to avid.com and check that out. So we're going to move on to another form of injectables here in Australia, and I believe it's also offered in Europe because I know Daan Spieard is actually on this, and that's Cystanin. Cystanin 250 is what it's called here in Australia, and again, it is not covered under PBS. So Testogel or Androgel and Reandron 1000 are covered under the pharmaceutical benefits scheme. So it is given to you at a discounted rate, and doctors can typically prescribe it out of the GP's office without issue. Cystanin, on the other hand, is not. The cool thing, though, about Cystanin, and the reason why it also is extremely effective and over a long-term period has extremely similar effects to that of the Reandron 1000 option, is because of all of the different testosterone esters or esters that are contained within the 250 milligram vial. Each 1 milliliter of Cystanin 250 has 30 milligrams of testosterone propionate. I'm going to read my notes for this one. 60 milligrams of testosterone phenylpropionate. Just bear with me, guys. I'm sorry. 60 milligrams of testosterone isocaproate. 100 milligrams of testosterone decanoate. There you go. That's all of it. And again, all of these references, all of the facts that I've been stating are provided in the description below under references. This form of testosterone is taken generally every 3 weeks. Big disclaimer here, though. If you are allergic to peanuts, you cannot use this form of testosterone because the oil that it's in is peanut oil. I might actually consider this one in the future as an option if I end up not getting certain results out of Reandron. One of the cons I forgot to mention about Reandron 1000 is some people report that they never stop their menstrual cycle on Reandron. After my second shot, my cycle is completely gone. So I don't know how true that rumor is for a general whole, or if that's just certain types of people who are having trouble with Reandron. But I know from my experience, after my second shot, I haven't had a cycle since. But I would consider cystanin because of the mix of esters. That particular mix matches or reflects most closely to what cis males have. They don't have just one kind of testosterone. Cis males don't have just one type of testosterone. They have a mix of esters. So the fact that cystanin exists that produces those similar esters, a combination of all of those esters, I would think would produce an even more natural experience of being male. In addition to that, I wouldn't have to go to the doctor because I could inject it myself. Last but not least, in case any of you by the end of this would really like to know, in every video I provided a table of expected changes and the timeline for those changes. I'm just going to put this table up here for a little extra while for you, just so you have a chance to really read through each thing. You have the time for expected onset for some of these things, like the skin oiliness and acne. Yep, that was pretty quick. I think I experienced the majority of my oiliness after my second injection, so after the first 6 weeks. Body fat redistribution, 1 to 6 months of the onset, I can absolutely say that happened. That started happening for me at around week 4, actually, so very, very quickly. So within the first month. Scalp hair loss. Scalp hair loss says 6 to 12 months. I have not been on Reandron yet for 6 months, and I can tell you right now that there's already been a change a bit in my hairline and the feeling of my hair, just its texture. I love my hair. I'm very afraid to lose my hair. I started using like a hair strengthening shampoo and conditioner almost immediately because I noticed a change so fast. So 6 to 12 months on Reandron, I would not say it's going to take that long at all. Considering how similar cystanin 250 functions in its results, I would say that you would experience very similar effects using cystanin as well. Increased muscle mass and strength, 6 to 12 months. I disagree. I think it happened very, very quickly for me. I started having strength increases within the first 3 weeks, muscle gains within 3 weeks. Water weight happened very quickly as well. Yeah, 6 to 12 months, no way. Definitely much faster than that. And it's only going to keep getting better. So, I mean, I would say when I hit the 6 month mark, which will be just a couple of months, I'm sure I will see an even bigger increase. And that's because my levels are only at my 12-week mark. I was sitting at 11 nanomoles. In nowhere near 20 yet, right? That's halfway to 20. So if I'm already experiencing these results at 11 nanomoles per liter, then I would say, or per milliliter, one of those. I would say that when I get closer to 20, then I'll see all of this even more. So we shall see what my results will be from using Reandron 1000. And so please continue to follow me if you want to know what it's like to be on Reandron versus the other cypionates and enthanates. Let's see, cessation of menses 2 to 6 months. Yep, 2 months. Vaginal atrophy. So 1 to 6 months. Well, I'm at what? 3 months? 4 months? Almost 4 months? No atrophy. Facial body hair growth. Expected onset 6 to 12 months. As I said earlier, nah, I'm not even at 6 months and I've got facial hair going. So I would not say it's going to take 6 months. Not if you're using Reandron or cystanin. No way. if you're genetically predisposed to have some facial hair, I would say you're going to get that pretty quickly. Other enlargements, 1 to 6 months onset, I'd agree. Deepening of voice onset, 6 to 12 months, absolutely not. If you go back and watch even my first, you can actually go back and watch my most recent update on my voice and facial changes, and you will not only hear the difference, but see the facial structure differences in just those 3 months as well. And it's continuing. As you can hear, my voice is breaking like crazy, and I haven't even been on it for 6 months yet. So, as I said, this is the average expectation of what you would see if you were on cypionate or enthanates or gels. But I cannot seem to find a table that represents what you experience on Cystanin 250 or Reandron 1000/Nebido. I cannot find a single table that matches the speed of my results. So that's why I'm making this video, because I think it's really important to note that this is the standard that you'll be presented by your doctors of expectations. And there's several tables out there. There's this table, and there's this table, and the one that I just showed you. And they're all very, very close. They're all kind of similar. One of them says, 2 to 6 months instead of 1 to 6 months. But the differences in them are not that remarkable. So why I'm experiencing these changes so quickly, and why other people who have been on Reandron or Cystanin have experienced things so quickly, we don't have results for. We don't have a table to compare ourselves to. So I wanted to provide this video so anybody that's out there that's considering either of these options really have a chance to hear a firsthand experience about it. If you want, I would highly suggest you check out Daan Spieard's channel. I'll provide his YouTube information below. He started on gels and is now on Cystanin, and even he says that since he switched to Cystanin, suddenly his facial hairs really come in strong. And his changes also were quite, I think, remarkable for having been on gel. A lot of people say that gel goes too slowly. And Daan's journey is a bit different to what you would see in mainstream, it seems to me, as well. It was actually because of his channel I considered gel, but then I just looked at the practicalities of it and went, nah, that I can't do it. He was also offered Nebido, and he was also offered Cystanin. He went with Cystanin. He's had great results. So though now you'll have the opportunity to look at what you probably have already been looking at, like Jackson Bird and what he did in his experience. You'll get to see Daan Spieard's version and how that went for him. You can look at Jamie Dodger, and then hopefully you have found my video and you get to find out a little bit more about what happens using Reandron. So, my friends, that is it. That completes the last episode of Testosterone all in one place. I really hope that it was beneficial, and that now you have a lot more information to take to your doctors or to take to your friends and family and be able to explain what it is, why you're choosing what you're choosing, what some of the risks are, what some of the pros and cons are, and now you'll have access to even more research and articles if you looked at the descriptions and went to those websites yourself. And yeah, I just really wanted to give this opportunity to all of you to learn all the things that I learned, and I hope that it helped, and I hope it was understandable. And if you have any questions or concerns, comments, if I was wrong about any of my information, or if I was incorrect about any of the information that I presented, if there's another subject that you'd like to have me present on YouTube for you, please comment it below and let me know. If you have any further information to back up these claims or to refute these claims that I've made on this video, please, by all means, put it also in the comments so that I can review it as well, because I like to learn things. And yeah, just thank you all so much for your support. Thank you for being here, for watching, and I'll see you next time. Hey, sorry, I did forget one particular disclaimer that's super important. I did not go into the risk factors that are inherent with GAHT. I did include the prescribing recommendations in all of the references below. So if you'd like to know the individual risks for any of the type of testosterone options that I have talked about in any of the episodes of this series, please review the references and the prescribing recommendations down below and talk to your doctor, because everybody experiences gender affirming hormone therapy differently. So I just wanted to make that clear. Also, if there is a particular type of testosterone that I didn't bring up and you do want to know what the risks are or what the prescribing recommendations are, please, all you have to do is Google prescribing recommendations / consumer information for blank. And I can almost guarantee you will find those recommendations listed. So it's usually a PDF. You can click on the link and it'll take you right to it. And then you already are going into the doctor's office armed with the information and what questions you might already have, so that you are receiving the amount of informed consent that you need. And last but not least, if you liked this video, please don't forget to like and subscribe below. Maybe give it a thumbs up if you want to, no obligation. And if you'd like to check out any of my other videos following my journey and watching my transition through the use of Reandron 1000, go ahead and check out that playlist, Journey of My Transition. And yeah, that's it. Thank you so much, and I'll see you next time. Peace.